So this project follows how these providers and patients come together, how these services are exchanged, and tries to capture why people in this city are sick. Why is there a hepatitis outbreak? Why can't people see the doctor? Why is heart disease so prevalent? Why is asthma so prevalent? And what are solutions that we just aren't envisioning in our formal healthcare system that can be filled in by groups of faith or volunteerism, and how do we reconcile that with what we think of healthcare today?
One of the first things that I have to do is talk to them about who their partners are as soon as they're coherent enough to talk about. I mean, these are things that are ideally that we're trained to do, but unfortunately or fortunately, the reality is that our training does not prepare us for dealing with the humanness that happens when people get a diagnosis. You have to listen because most times people want to be able to vent. They are hurting, they are angry, they're confused, they're fearful more than anything. And sometimes I have just sat beside someone in the bed and just held their hand because that's what they needed. Or I've sat in front of them and let them rage at me because that's what they needed. Or I've more than too often, or more often than not, I have held folks and let them cry because that's what they needed. Whatever is needed at the moment.
It's gratifying to make such an impact. You know, things for simple things to us, like, you know, clean socks or something like that, means a lot to people who are out on the street, and they're very grateful. 5 years ago, a first year medical student from Wayne State, Johnny Wong, came to us with the idea of doing outreach. He had read an article about Dr. Jim Withers in Pittsburgh, who runs this Operation Safety Net, where he actually goes out into the street with nurses and students and finds people, you know, in the parks or in underpasses and that sort of thing, and brings medicine to them. And so Johnny Wong suggested that for us using Wayne State School of Medicine student volunteers, and my boss liked the idea, so we went with that. So we go out in a van, a big 15-passenger van, and we have what's called a peer support specialist. We call them street navigators, but they are formerly homeless people themselves who now work here, and they can help establish rapport with people that we meet.
Um, yeah, like worrying about it get cold, or not even that, just not knowing where you're gonna live is just very depressing, you know. And I mean, even if I had a place to live, then I wouldn't worry so much about my health because I just feel like, well, if it is time for me to go, it's time for me to go. If they won't pay for an operation and I need it, then it's that. You know, I've lived, at least my kids are good. But I don't know, man. It just seems like no one should have to be like out here.
Oh, it would be catastrophic for this population if the Affordable Care Act were repealed. It's literally saving lives and saves money, you know, because if you're uninsured, these relatively minor conditions that could be easily managed go untreated until it's catastrophic and very expensive.